This is a work of art.
It was a sunny Thursday morning when Mrs. DuPont, after being discharged from the hospital, was experiencing a great deal of pain from surgery. Her child was named Harris DuPont. Harris DuPont is a 2-day-old, 8 pounds and 2 ounces boy born by cesarean birth following placement of circlage sutures in his mother. His mother planned on breastfeeding him since the 4th month of pregnancy. However, due to post-surgery pain and sore nipples, the mother, Mrs. DuPont, is not certain if she still wants to breastfeed her child. Thus, Mrs. DuPont called her OB to relay and consult her concern. I'll call na lang kaya. Okay. Tawagan na lang kaya natin yung OB ko. Hindi ko talaga alam yung gagawin eh. Okay, tawagan na natin. Call. Hi, ano pong gagawin ko dito sa sakit ng breast ko? Wow, naman yung anak ko. Hello? Yes, hi, hello, good morning. I'm Mrs. DuPont. I'm so sorry for calling you at this early hour, but may I know if my OB is available?
Hi! I'm sorry, but right now your OB is not available. However, may I know your concerns to assist you with your needs?
Oh, okay. So, can I set up a Google Meet with you na lang today para we can talk about it ng one-on-one meeting and para mas maintindihan ko? Oh, okay. Sige. Okay, sige. I'll see you in the Google Meet na lang. Okay, thank you! Okay, ayan na. Tara, mag-Google Meet na tayo. Hi again! So, hindi ko na sinama yung anak ko dito kasi pinatulog ko muna siya. Anyways, yung chief concern ko is that my breasts are too sore to breastfeed. Tapos, kakapanganak ko lang sa hospital nyo 2 days ago through a cesarean birth.
So, bale, iti-check ko muna yung records nyo dito sa system namin para mabilis po yung process natin, ano? So, saglit lang po, ha?
Okay, sige. Go on. You can take your time. After 5 minutes of waiting, the nurse came back with her record chart.
Okay, nakita ko na po yung records and according to our system, nanganak ka dito sa hospital namin and na-discharge ka din after 48 hours. Anyway, ma'am, ano po yung pinaka-main concern natin?
I was able to breastfeed my child for 2 days naman, every 2 to 3 hours for 10 minutes each breast. There were no problems with my breast 2 days ago. It was firm and filling. My nipples are protuberant pa nga eh. My child, on the other hand, is alert and sucks well. And yung weight niya is 8 pounds, which is normal. Kaya lang, not until this day, bigla na lang ako naka-experience ng sobrang pain sa breast ko. Pero feeling ko, I think it is because of the effect of my post-surgery. Alam mo ba, I was planning to breastfeed my child since the 4th month of my pregnancy. Pero nung naranasan ko yung surgery and yung pain and soreness sa breast ko, parang bigla akong napaisip, I doubt, parang ayoko na. Actually, ngayon, hindi na ako sure kung itutuloy ko pa ba yung pagbe-breastfeed sa anak ko.
Oh, okay. So, in order for me to come up with a good plan for your situation po, may mga itatanong lang akong some few questions. Maaari niyo po bang sagutin siya ng full honesty po?
Sure, go on.
Thank you.
Okay lang naman sa akin.
So, ang first question ko is, ano po yung perception nyo sa breastfeeding or do you have any knowledge ba about sa pagbe-breastfeed?
Actually, wala talaga akong background or malawak na knowledge about breastfeeding because of our family history. And I am the only child sa family namin, so I really lack experience with newborns. Tapos yung mother-in-law ko pa did not breastfeed any of her children. Pero despite that, she stays with me naman sa bahay for a week para tulungan ako sa anak ko. And yung husband ko is very hands-on naman sa pag-alaga ng anak namin. Pero sadly, he doesn't see any reason kung bakit necessary yung breastfeeding. Kaya ayun po, feeling ko naging factor din po siguro yun.
So, right now, babanggitin ko yung records nyo here para ma-confirm ko if tama po ba. Okay lang po ba yun?
Sige po. I listen
Thank
carefully.
you. So, about your history of family illnesses, the child's paternal grandfather has an elevated cholesterol level and blood pressure, right?
Yes po. Tama
Okay.
po yun.
And then, your child's maternal uncle has hepatitis C.
Correct din yun.
About your obstetric history, you give birth to 28 weeks infant, but because of your incompetent cervix 2 years ago, your baby died 2 days of age.
Yeah.
Okay, thank you. And then in your 14th week of this pregnancy, cerclage sutures are placed to you.
Yeah. Yes. Yes po.
And you didn't experience any complications or threatened labor during pregnancy, and the membranes did not rupture, right?
Yes. Yes po.
Okay.
Other than the previously said information, there were no other complications during my pregnancy. Flashback. Mrs. DuPont, together with her husband, were in the operating room and she is now ready to deliver her healthy baby boy. After 1 to 2 hours of cesarean delivery, the essential interpartum and newborn care is being done by the nurses. In this case, the unang yakap or first embrace is established to develop a bond between the mother and the infant. After that, the baby, Harris DuPont, was assessed by the assigned nurse. Part of the infant's assessment were physical examination and laboratory tests for hemoglobin and hematocrit. After 2 days, the mother, the husband, and their infant were already discharged from the hospital.
So about the physical examination of your newborn infant, according to our records, he has height of 20 inches or 51 cm. His head circumference is 35 cm. His temperature is 37 Celsius. His general appearance is well-proportioned, alert, and male newborn. About his head, it is normocephalic, no molding, anterior fontanelle is 3 cm by 3 cm, posterior fontanelle is 1 cm. Your baby's eyes have a presence of red reflex and it follows the midline without difficulty, which is good. His ears have a normal alignment and canal pattern. His nose is midline septum and no drainage. His mouth right now doesn't have teeth and has a palate intact and midline uvula. His next lymph nodes are not palpable and he has midline trachea. So about his chest naman, occasional rhonchi is present, no rales, and he has respiratory rate of 20 breaths per minute. His heart doesn't have any murmurs and heart rate is 145 beats per minute. His abdomen is soft, no masses, and the liver is palpable 1 cm. About his genitalia, he has normal male organs. His testes are palpable in scrotum bilaterally and he has midline meatus. About his extremities, he has full range of motion in upper and lower extremities and his hips are abduct readily. In the neurologic sector, he is Moro, sacking and rooting, step in place, cross extension, tonic neck reflexes are present. So about your laboratories, infant's finding, his hemoglobin is 90.0 and his hematocrit is 56%. Are all of the data that I have discussed matches your infant's data?
Yes.
Okay, that's all the information that I need. So in order for me to meet your demands, I will make a health teaching and nursing intervention or nursing care plan that will be discussed in the scheduled meeting that I will be making. Is that okay with you?
Yes, that would be a big help for me.
Okay then, see you in our meeting and don't hesitate to call us if ever you need something.
This is noted, nurse.
Thank you so much.
Thank you so much.
As for number 6, you should teach Harris's mother that an advantage of breastfeeding for her is which of the following. So let's do the elimination method first. I think it's not letter A dahil breastfeeding, it does not stabilize hormone levels. Instead, it causes hormonal imbalance or fluctuations. Sabi nga nila, nakaka-experience sila during breastfeeding ng menopausal-like symptoms. Dahil minimimik nito yon. So, dahil ito sa prolactin natin or yung milk-producing hormone dahil temporarily binablock nito yung estrogen sa katawan natin. And then next is letter B. I think this is wrong also dahil fibrocystic lesions, nangyayari ito kapag nagsisignal na yung hormones natin to produce or to make milk sa breast natin. So, this is wrong because it usually come and go. Pero, hindi once na nakapag-breastfeed ka, but nawawala na ito kapag once na nagkaroon na ng period yung mother. Letter C, I think this is wrong too. Dahil during breastfeeding, nagpa-produce or nagre-release yung katawan natin ng oxytocin, which causes contraction sa mga smooth muscles ng katawan. So, more contraction siya sa uterine. And hindi rin siya nakakapag-decrease ng after pain dahil instead nakakapag-cause ito ng pain or ng cramps. And then the last one, I think this is the answer for number 6, letter D. Breastfeeding may decrease her later risk of breast cancer. Dahil during pregnancy and breastfeeding, nagsished tayo ng breast tissue. And this shedding can help them remove cells with potential DNA damage, thus helping to reduce the chances of developing breast cancer.
For the 7th question, you are teaching Harris's parents about the advantages of breastfeeding. What possible benefit should you describe? And for the options, the first one is breastfed babies gain more weight than those who are bottle-fed. Second, breastfeeding supplies positive antibodies to the infant. Third will be it causes a mild acidosis that lowers cerebral pressure. And the fourth one, it can make skin more resistant to fungal diaper rashes. And for the answer for that, it will be the second option, which is the breastfeeding supplies passive antibodies to the infant. So for the choices for the 7th question, so bale dun sa first choice dito is hindi naman din guarantee na porket breastfed baby siya is magigain na siya ng weight than those babies who are bottle fed. Merong mga studies na nagsasabi na parang mas mabilis nga daw mag-gain ng weight yung mga bottle fed kaysa dun sa mga breastfed na babies. And also, hindi rin naman nagkakos ng mild acidosis yung breastfeeding that may lower the cerebral pressure. And lastly, hindi rin naman nagiging more resistant to fungal diaper rashes kapag breastfed si baby. Usually kasi yung diaper rashes caused by irritation na yun. So, it is not a guarantee na kapag nagbe-breastfeed ka, nagiging resistant na siya sa fungal diaper rashes. So, therefore, the correct answer will be breastfeeding supplies passive antibodies to the infant.
Question number 8. Breastfeeding would be contraindicated under which condition? Letter A, a newborn weighs over 10 pounds. Letter B, a mother has an allergy to heat. Letter C, an infant develops galactosemia. Or letter D, a mother is taking ferrosulfate. The correct answer is letter C, an infant develops galactosemia, because infants with galactosemia cannot digest lactose in milk. Letter A is wrong because weight does not matter. It still requires breastfeeding. Letter B is also wrong because if the mother has an allergy to heat, then she should just not eat heat. This is not correlated to her breastfeeding infant. Letter D is also wrong because intake of ferrosulfate is safe while breastfeeding.
For question number 9, which statement by Harris's mother would suggest she will most likely be successful at breastfeeding? The right answer would be, I understand to begin each feeding on an alternate breast. But before that, let me explain why I did not choose B, C, and D. For letter B, I know breastfeeding is painless, so it should be a lot of fun. This statement is contradicting the current situation of Harris's mother, wherein she is experiencing pain while breastfeeding the baby. For letter C, I know the less I drink, the more concentrated my breast milk will be. The concentration of the breast milk is not only affected by the fluids consumed by the mother. It is also affected by, for example, the mother did not breastfeed Harris for a very long time. The concentration of the breast milk will be much higher because it is not expelled regularly. And also, if the diet of the mother is consisted of dry foods, the fluid or the consistency of the breast milk will also be affected. For letter D, I understand that some breastfed babies develop toxic reactions to their mother's milk. The terms that the mother used, such as develop toxic reactions, is quite a broad topic, and it's also quite complicated to explain and to be understood easily by a mother. So if the mother is using such terms, the mother may be copying or just repeating the words of the nurse, and this does not show that the mother had learned what the nurse taught to her. And this indicates that the mother needs further education in terms of breastfeeding. And now we did choose letter A. I understand to begin each feeding on an alternate breast. This is correct, and this shows that the mother would be successful at breastfeeding because this is the right method. It is suggested that for each breast, it should be 10 to 15 minutes, and then switch to the other side 10 to 15 minutes, and that's a whole session. And this session will repeat every 2 to 3 hours, and that is why we choose letter A as our answer.
For question number 10, suppose Harry's mother has a large breast. To allow Harris to suck better, it may be necessary for her to take what action? Letter A, massage her breast daily to try to decrease their size. Letter B, support the bulk of a breast away from Harry's nose. Letter C, wear a bra during feeding. And letter D, place cow's milk on her nipples to encourage sucking. The correct answer is letter A, which states that massage her breast daily to decrease their size. This is the correct answer because when the lactating mother massages her breast, it can help to express more of their milk that will lead to decreasing the size of their breast. Letter B is a wrong answer because the problem here is the large breast of the mother, not the heaviness of her breast. Therefore, supporting the lactating mother's breast will still hinder the child in sucking her mother's breast. Letter C is also a wrong answer because wearing a bra doesn't just make any difference, but it also hinders you for being convenient in breastfeeding. Letter D is also a wrong answer because even if you put different types of tasty foods in your nipples, it still doesn't change the fact that the breast of the lactating mother is large and the infant cannot tolerate it.
If a newborn cannot be breastfed, which of the following would be suitable substitutes? A. Cow's milk, B. Fat-free milk, C. Commercial formula, or D. Evaporated milk. The answer would be commercial formula, letter C. When breast milk is not an option, commercial infant formula is the only suitable alternative for the first 12 months of life because unlike the other options, commercial infant formula is sure to have adopted to meet the basic needs of the infant for growing. Meron itong protein, iron, and minerals. So, nag-undergo ito sa thorough research and approvals para ma-make sure na yung content na meron ito ay safe for the babies or the infants. Meron itong 3 forms. So, one is ready to use, which is sterile at the time of the purchase. It is very easy to use, yet very expensive. Next, second one is concentrated liquid, also sterile at the time of purchase. It's easier to use and safer than powdered form, and it must be diluted with water. Third naman is powdered, which is not sterile at the time of purchase, and it has greater risk of contamination because it requires more handling. Nagre-require din ito ng care during the dilution step kasi baka meron tayong masama na habang tinitimpla ito or dinidilute natin rather than dun sa concentrated liquid. Bakit naman hindi suitable ang cow's milk and evaporated milk? So, babies under 12 months of age should not have normal cow's milk or evaporated milk kasi maglilid ito sa severe nutrient deficiencies and Isa dito is iron deficiency kasi ang cow's milk ay mababa sa iron content. So, mahirap siya for the infants kasi kailangan nila ng iron habang lumalaki. Evaporated milk is just cow's milk in concentrated form. Although recommended siya, hindi pa rin siya suitable kasi iba pa rin ang breast milk sa evaporated and cow's milk. Both of evaporated and cow's milk have 3 times the protein of human milk, less carbohydrates, and lower levels of vitamins A, C, D, E, and niacin, and iron. Bakit naman hindi suitable ang fat-free milk? It is because fat-free milk or skim milk contains no fat at all. So basically, hindi rin siya suitable kasi walang makukuha na fat or the fat from that milk is not enough for the infant. Since kailangan ng infant ng fats for brain development, hindi suitable ang fat-free milk kasi nga kulang ito sa fats. So, it's not that healthy for the brain development.
The nursing care plans. For this case study, we have developed 3 nursing care plans and we will start off with the first one. Nursing care plan 1, for assessment. Under subjective data, the mother verbalizes that she is experiencing a great deal of pain from surgery. Next, the mother stated that she planned to breastfeed her infant, but because of the surgery, she is not as certain if she still wants to breastfeed. Under objective data, the mother's breasts are firm and filling. Her nipples are protuberant. The mother is G2, T1, P2, A0, and L1, meaning she has undergone 2 pregnancies, 1 term birth, 2 preterm births, 0 abortion, and 1 live births.
For our diagnosis, we have powerlessness related to insufficient knowledge to manage the situation as evidenced by post-surgery and social support.
For planning, under short-term goal, after 3 hours, the patient will be able to verbalize her understanding about the proper care of a newborn child. Under long-term goal, after 24 hours, the patient will be able to breastfeed her child properly along with her complete knowledge about the situation.
For intervention, we have 3 types of intervention. First is the independent, second is the collaborative, and lastly is the dependent intervention. So let's go first in the independent intervention. First in the list is encourage the patient to think productively and positively as well as to accept responsibility for their thoughts. And the rationale behind that is to encourage positive thinking and to elevate breastfeeding apprehension. Second independent intervention is to encourage the patient to consider options in care, such as food, bed, and environment whenever possible. And the rationale behind that is it allows the patient to control as many events as possible, as care restrictions may allow the client to have some sense of control over the situation. Third intervention is to encourage the mother to use a breast pump. The rationale behind that is it allows her to rest her body every time the infant needs breast milk. And the last independent intervention is to encourage the mother to get enough sleep, drink plenty of water, and eat a nutritious diet. The rationale behind that is we want to ensure that adequate milk production and breastfeeding procedures are followed.
Under collaborative intervention, first, examine the mother's perception and understanding of breastfeeding as well as her level of education. The rationale for that is to determine what the mother already knows and the need for additional instruction. Second, collaborate with other teams in giving the mother emotional and informational support. The rationale for that is to encourage the mother to continue breastfeeding as desired. Third, collaborate with a breast care specialist on how to reduce soreness in her breast and how to take care of herself after surgery. The rationale for that is to ensure the mother regains her energy so that she can continue to breastfeed her child. Fourth, collaborate with a physician regarding the use of breast pumps and demonstrate how to properly use them. The rationale for that is to help the mother rest her body and conveniently give the infant a breast milk. Under dependent intervention, first, consult with support groups for counseling or therapy as appropriate. The rationale for that is to provide desirable assistance in resolving problems and give mothers relevant information on how to handle pregnancy challenges. Second, consult with a dietitian regarding the use of string method and express breast milk. The rationale for that is to ensure proper nutrition and to encourage the lactation process to continue.
For our evaluation, the goal was met as evidenced by the patient being able to properly breastfeed her infant without experiencing obscure challenges.
For the nursing care plan number 2, for the assessment, our subjective data is that the patient admits lack of experience with newborns. Objective data, patient's breast is firm and filling, protuberant breast, breastfed for 2 days every 2 to 3 hours, and 10 minutes for each breast. For the diagnosis, deficient knowledge related to lack of exposure to breastfeeding as evidenced by verbalization of lack of experience of the mother, as I had mentioned earlier, which is it is under subjective data. For the planning, our goal is to verbalize understanding of breastfeeding techniques and proper patterns of feeding. For the intervention, first is the independent interventions. First is to determine the client's readiness to learn, to ensure that the client is holistically ready for the learning, because some patients cannot take in the information given to them, especially when they are in pain. Maybe they are emotionally unstable. Those kinds of things can affect the learning of the client. Second is identify the support persons of the client. This is to help the patient to calm down and feel at ease when learning and performing breastfeeding techniques and patterns. Third is to educate the client on proper holds for breastfeeding. For example, football hold, cross cradle, and side lying. This is to ensure that the client will execute the right hold for the baby and the right hold especially for her condition. And for cesarean, it is advised to perform side lying hold for breastfeeding. Next is to educate the client on the intervals and frequency of breastfeeding to help the client make an informed decision and frequency of breastfeeding. Next is to educate the support person of the client on the needs, techniques, and guidelines on breastfeeding, to have a support and guide when the mother is breastfeeding, because sometimes the mother will breastfeed and then the nurse would be going outside, so the support person can also assist, and this is also makes the client more at ease and comfortable when breastfeeding. Lastly, for the independent interventions, educate the client and support person on the importance and benefits of breastfeeding for the baby. This is to increase the likelihood of the client to continue and complete exclusive breastfeeding, because there's a lot of benefits such as natural antibodies, it lessens the risk for infection of the baby, those kinds of things. For the collaborative intervention, first is to collaborate with the nutritionist to create a diet plan necessary for the client's condition. This is to provide adequate necessary nutrients for the client. Next is to collaborate with the breast care specialist to help in caring for the client's breast to be able to breastfeed and relieve pain when it's still persists. And lastly, refer to the support group for counseling as appropriate to provide mother with adequate knowledge about breastfeeding and its importance. For the dependent interventions, we have is consult with the tending physician to know and confirm the things that is contraindicated for the client based on her current condition. And lastly, administer prescribed medication, fluids, and nutrition to the client. This is to ensure proper recuperation of the client, to treat underlying conditions, and ensure proper nutrition. For the evaluation, the goal was met as evidenced by the client verbalizing concerns on breastfeeding and showing positive feedback on the breastfeeding plan applied.
For the third nursing care plan for assessment, for subjective data, the client reported that her breasts are too sore to be able to breastfeed. And for the objective data, the patient's breasts are firm and filling. Nipples are protuberant. Moving forward for the diagnosis for the nursing care plan 3 is ineffective breastfeeding related to inflammation of the breasts as evidenced by patient reporting pain in her breasts.
For the planning, the short-term goal is after 5 hours of nursing intervention, the client will demonstrate techniques in relieving pain. The long-term goal is after a week of nursing intervention, the client will be able to breastfeed her baby properly. The independent intervention is first establish rapport because building rapport helps establish a good relationship with the client, making it easy to perform the following intervention. Next is perform physical assessment, noting appearance of breast and nipples, mark asymmetry of breast, obvious inverted or flat nipples, or minimal or no breast enlargement during pregnancy. The rationale of this is identifies existing problems that may interfere with successful breastfeeding experience and provides opportunity to correct them when possible. Encourage frequent rest periods, sharing household or childcare duties. This is to limit fatigue and facilitate relaxation at feeding times. Next is encourage client to wear 100% cotton soft and absorbent fabrics for nursing pads. This allow the breast to breathe. Also educate to change the nursing pads whenever they get wet because constant exposure of breast to wetness could result to skin irritation and sore nipples. Next is wear a supportive bra, apply heat or cool application to breast, and massage from chest wall down to nipple. This is to enhance letdown reflex which makes the breast milk flow and also to promote breast softness so that the infant can suck properly. Inform the mother how to assess and correct latch because correct positioning and getting the infant to latch on will allow the infant to suck properly and comfortably. And recommend avoidance of overuse supplemental feedings and pacifiers. Supplemental feedings and pacifiers can lessen the infant's desire to breastfeed or increase risk of early weaning. Lastly is discuss and demonstrate use of breastfeeding aids because breastfeeding aids promote comfort for both mother and infant.
As for our collaborative intervention, we should collaborate with support groups. Its rationale, this may fill a gap between medical treatment and the need for emotional support. Lalong-lalo na at kakapanganak pa lang ni patient and inadmit niya na she lacks experience with newborns. This can also help her prevent from having postpartum depression. For the dependent intervention, we should consult with a physician in administering a pain reliever kapag hindi na kaya ni patient yung soreness ng breast niya. So, kailangan na ng pain reliever and ang rationale niya, only physicians can prescribe medications to the patient. Also, to confirm if there is any contraindications. Lastly, the evaluation. The goal was met as evidenced by proper practice of techniques in relieving pain and breastfeeding. So, dapat makita natin na kayang ulitin ni mother kung paano yung proper practice of techniques na pag-relieve ng pain. Yung tinuro natin kung paano i-relieve yung pain ng breast niya and kung paano yung proper breastfeeding sa baby niya.